Polycystic ovarian syndrome is actually evolving from not just a reproductive disease and not just a disease that leads to irregular periods or problems having children, but there's a new concept about polycystic ovarian syndrome which we want to alter the thinking into saying that it also influences our everyday metabolism. It has risk factors associated with this later on in life. So what we see is that someone with polycystic ovarian syndrome has higher risk for cardiovascular disease and has higher risk for cholesterol abnormalities and higher risk for type 2 diabetes later on in life. So it should be also taken as a warning signal for many young individuals who present with PCOS that there's a chance there that they can prevent those diseases from occurring. PCOS patients actually are usually presenting when they're younger because the irregular periods tell them go see a doctor. Usually other signs and symptoms might not be as apparent or thought to be, just part of normal sort of changes with life, such as acne or abnormal hair growth. But the irregular periods usually bring those patients in. So we see these patients in their 20s or maybe 30s when they're first trying to have a child, but these other risks that occur with PCOS don't present until they're 40 or 50 years old. So we do have a chance of preventing these issues from occurring in this population. Absolutely, having regular checkups, an annual exam through an OB or through a primary care provider, bringing any symptoms up to any symptoms or any concerns up to them so they can screen you effectively is extremely important. Women tend to ignore a lot of these symptoms, but there's so much area here that we can prevent disease, so it's a good idea to see a primary care doctor or your obstetrician annually and bring up any of these concerns. But it's amazing with polycystic ovarian syndrome, there's also increased chance of sleep apnea. There's also increased chance of fatty liver. So a lot of these disease processes actually accompany this. So a thorough exam and knowing your risk is extremely important.